So I'm out here on the trail and I thought, what a good time to talk to you about erectile dysfunction. Regarding taking VIAGRA or that classification of drugs, that's really a discussion for your doctor directly. Have them review the side effects and whether or not it's a good fit for you. It would be unethical for me to tell you not to take it. With that said, there are some concerns that we could look at. That medication, what it does is it forces blood into the penis. And when I took pharmacology, the medical doctor who was teaching the class, when he got to this drug, he got all serious and he said, don't ever take this medication. And he described the anatomy of the penis, which has a lot of small trapdoor sections, you could say, like the spongiosa cavernosum. These are areas where blood goes in and it's held onto to create the erection. And then it's released once everything's complete. Well, those trapdoors are very tiny and they can get damaged. And by forcing blood into that part of the body, those trapdoors do get damaged. Let's say that you take it only one time, but there's 5% damage to these trapdoors. That's permanent damage. Holistically, we can always improve your circulation. But once those trapdoors are damaged, they're irreparable if that damage happens to you. The male patient, after using it a number of times, might find that erectile quality has gotten worse, but men aren't going to bring this up. It's deeply humiliating, plus men don't want to talk about this topic. And on top of that, because it may have accumulated slowly, they may think that it's them. Maybe they're just getting worse. But in fact, they're not getting worse. There's permanent damage being done. I once had a young male patient come to me who was about 30 years old, and he was very fit and he was very healthy in every measurable way. But he couldn't get an erection at all. And so after an intake, I discovered that he was taking these medications not because he needed to, but because he was a bit of a party animal. And why not have a super duper erection so that you can go all night kind of thing? Nonetheless, he was using it regularly. And he reached a point where he couldn't get an erection at all. And I did a male saliva hormone panel on him. On paper, his hormones were perfect. He was fit. There was no cardiovascular problems. His pulses were good. His medical doctor couldn't help him. And I decided I was going to do some strategies to see if I can do anything to help this male. But in the back of my mind, I was thinking of my pharmacology teacher telling me that this might be some sort of permanent damage. And truly, no matter what I tried, nothing helped this young man. This man had reached a point of such damage from that medication that he'll never get an erection again the rest of his life. Let that sink in. The only way he'll be able to fix this is surgical. He's going to have to get a pump installed. Like I said, I'm not telling you not to take it. Talk about it with your medical doctor. But if we look at it holistically, male health really comes down to two aspects, and that's going to be the hormone system, which we're going to catch a glimpse of, at least the sex drive and vitality, energy levels, all the things associated with the hormone system, and then blood flow, because as already stated, the penis is a blood flow organ. A good example of this is around COVID, when the spike protein was causing an impairment to circulation, and men commonly were losing their ability to get an erection after getting COVID. This is probably not something you've heard of anywhere else, but remember, I ask all these questions. And especially when you have a young man, a 25-year-old, who otherwise is perfectly healthy, and their sex drive is still good because spike protein doesn't affect the sex drive, and we're having all these blood flow symptoms and heart palpitations, rapid heart rate, and fatigue and brain fog, and they can't get the erection, and their tongues are purple, we know that it's a circulatory problem. In those cases, and I saw many of those patients, we treated their circulatory system and everything went back to normal because plant medicines are highly effective. So with holistic medicine, the goal is to improve function, improve circulation, and support the hormone system. You go conventional care, they're going to replace the hormone system, which has diminishing returns and cancer risks long term. And then they're going to force something with blood flow that is damaging and destructive. But it's up to you. Hopefully, this just helps you ask better questions so you can make a decision that's right for you.